Hello everyone. Thank you so much to all the people who have subscribed in the channel. You mean a world to me. Anyone watching this and is not subscribed, please I ask you to subscribe. It is free, and you will be supporting me to build the channel. Thank you. Anyone with empathy and compassion watching this will be shocked and outraged. Why is this allowed to be the norm? Welcome to America, the land of the free. These people need desperate assistance, but it is evident their government has more important agenda such as looking after Ukraine and Israel. Billions of tax dollars is being spent looking after non-American people. The zombies you are looking at are America citizens perishing in drug addiction. Shame on America. How do they not fall down all hunched over like that? They have precision balance, I give them that. They balance better than my yoga instructor for sure. Being able to pull off some of these yoga positions for hours at a time fails me. It takes a lot of hours of yoga practice to do that shit. This is heartbreaking. On the serious note, there is a common saying that addiction does not discriminate, which means that it can affect anyone from any sphere of life. It can happen to a truck driver, accountants, doctors, office executives, footballers, the common man or woman on the street, and lawyers. This is the where equal opportunities come true. Drug addiction does not discriminate. Drug addiction does not care about your heritage or education, your medical degree, masters or diplomas, nor does it care about race, gender, religion, social status, or health. I cannot even begin to judge the people addicted to drugs because each one of them have their own individual story. We do not know how they were treated as they were growing up, and nor do we know what may have happened to them as adults. Everyone has their own story to tell. Every story is going to be absolutely different. In another critical sense, addiction does discriminate among people, in a way that is unjust and deadly, and in a way that shines spotlight on tears in the socioeconomic web that is holding our society together. It has been long observed by clinicians that socio-determinants of health can tip the scales against people in their already daunting quest to recover from any type of addiction. According to the World Health Organization, socio-determinants of health are defined as the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. The profound effect that socio-determinants of health have on people struggling with addiction is borne out by the evidence. Drug and alcohol, along with opioid overdoses, are concentrated on a more economically disadvantaged postcodes or zip codes. Areas of high rates of poverty, unemployment, as well as lower education are susceptible to opioid overdoses. Other studies have found poverty to be a risk factor for opioid overdoses, unemployment to be a risk factor for fatal heroin overdoses. Homelessness has been shown to be associated with overdoses. These are all terrible outcomes associated with drug addiction. A patient can be stable for years on buprenorphine or methadone. These are medications to manage cravings and help with recovery. But if they abruptly lose their housing due to no fault of their own, they can lose access to the organization and security in their lives. It becomes far more difficult for them to care for their families, to attend medical appointments or support groups, to fill prescriptions, or to practice any of their self-care that is so integral to maintaining oneself on recovery. As such, they become much more vulnerable to relapse. Stigma too plays a great role in addiction. Stigma is defined as a mark of disgrace associated with a certain quality, circumstance, or a person. The poor regard with which so many people have viewed for so long those who have suffered addiction, and the fact that we as a society have criminalized drug usage in our increasingly unpopular war on drugs, have contributed to a punish, do not treat attitude. Fortunately, this destructive attitude has recently been evolving, as more people come to understand that addiction is, at least in part, a brain disease, and that it is not a moral failing on the part of the individual. However, a great deal of stigma remains, and provides extra barrier for people asking for the help they need, as they suffer from unnecessary guilt and shame. There are some healthcare providers who are not willing to deal with people suffering from addiction due to stigma. In short, stigma can lead to unnecessary suffering and rejection. As a society, and also for the clinicians, we all need to go far beyond simply viewing the drugs as a problem. In order to give everyone suffering from addiction the best chance possible to enter and stay in recovery, we all need to start paying attention to the broader issues that allow addiction to fester, such as housing, employment, poverty, systemic racism, and the effects of incarceration. This is to name just a few. By strengthening society's safety net, so that we all have access to the basic human rights of food, shelter, and healthcare, we not only help those suffering from addiction, we help everyone else too. Addiction can be devastating. Just watch these zombies right there. The good news is that there are a lot of effective treatments for addiction, including self-help strategies, psychotherapy, medications, and rehabilitation programs. One can also find targeted advice on specific types of addiction, as well as information about coping with a loved one's addiction. Several scientific advances have shamed our understanding of the common and complex problem. For example, brain imaging technologies have revealed that our brains respond similarly to different pleasurable experiences, whether derived from psychoactive substances, such as alcohol and other drugs, or behaviors. Genetics research has uncovered that some people are predisposed to addiction, but not to a specific type of addiction. Finally, medications developed to treat one addiction have, in some cases, proven helpful for treating a different type of addiction. One can protect and heal from addiction by having diverse interests that provide meaning to one's life. Understanding that life's problems usually are transient, and perhaps most importantly, acknowledge that life is not always supposed to be pleasurable. Therefore, you do not have to use a psychoactive substance to get away from the negative things that happen in life. Instead, you can use other strategies such as going for a run, reading, clean the garden. Just engage with something positive. Looking at these zombies, I believe the only way out is to force them to have treatment. Yes, mandatory drug treatment. The government needs to step in. It may sound harsh, but it saves lives. They should also be encouraged to follow some kind of training to better themselves for the future. I can see a lot of premises boarded up. All that whole area should be developed. London used to have hotspots that the majority PF people were afraid to visit, such as King's Cross, Elephant and Castle, Hackney, Brixton, and many more. However, all these areas have been regenerated. They are clean, they are safe, and they are becoming international. Lots of Americans live in Elephant and Castle. The above areas have been cleaned, and Londoners enjoy those areas now. The mayor of Philadelphia needs to do something about that area. He needs to save the community. The people should force the mayor to turn around this place. Right now, it looks like drug addiction is normalized in Philadelphia. At least, that is the impression that I am getting from what I am seeing right in front of us. I think people are dead blind to what is happening around them. It is hard to believe this is America. It is definitely a land of dreams. America will take care of the world, but it will not help its own citizens. What a blunder. May your dreams come true.